Good morning. Looks like we're live. Okay, great. So, thank you for watching me live. If you are watching the replay, thank you for that. If you are watching the replay, please type replay in the comments so that I know that you're joining in and listening. If you've been following me, you know that I've been going live every day talking about different clinical sleep medicine tips for physicians and therapists that you can use in your outpatient practice. I'm Dr. Nishi Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine, and I have a YouTube channel teaching physicians and therapists all about clinical sleep medicine pearls, and I have an online course that is going to be opening up in a few weeks about clinical sleep medicine. It's called the Clinical Sleep Kit, so I can share more about that later if you're interested. And then I also have a free mini course on sleep medicine that teaches you the fundamentals of sleep medicine principles that you can use in your practice straight away. So I'll put that in the comments. The link to that will be in the comments. Okay, today's topic is the components of CBT-i, or cognitive behavioral therapy for insomnia. This was a request from Dr. Abby. So thank you, Dr. Abby, for submitting that question and that request. So we'll just do a really quick overview of CBT-i components because I am in clinic today, so we'll just do a really quick one. And if you have any questions, if you want to clarify anything, you can put that in the comments. And then before we jump in, if you are watching the recording, please let me know where you're joining from, what your specialty is, and what questions you have about sleep, and I'll be happy to answer them on these live videos. Okay, yesterday we spoke about resources for CBT-i, or cognitive behavioral therapy for insomnia, for your patients. Oftentimes we think of the one-on-one practitioner, and it can be really hard to get patients in with a CBT-i practitioner. They're hard to find. First of all, there aren't a lot of them, and then there's often a long wait list. But there's so many resources available these days, especially with technology, that you don't have to wait months to get your patient in to see a CBT-i specialist. So check out yesterday's video for an overview of the various resources that are available. Okay, today we're talking about the basic components of CBT-i. So first of all, what is CBT-i? It's cognitive behavioral therapy for insomnia. It is the first line gold standard treatment for chronic insomnia, as recommended by the AASM, the American Academy of Sleep Medicine. And this is what patients should be doing when they're struggling with insomnia. Often we jump to thinking about medications or supplements or other external things. Sometimes those things can be helpful, but really what changes things for patients in the long term is CBT-i. And actually the data shows that CBT-i has more durable results over time. So they have better long-lasting results over time for insomnia compared to medications. And of course it doesn't have side effects, right? So that's always nice. And then you're teaching your patients skills that they'll be able to use forever. They're not reliant on an external sleep aid. Okay, when people think about CBT-i, especially patients, they often conflate that with sleep hygiene. Sleep hygiene is not CBT-i, and CBT-i is not sleep hygiene. Sleep hygiene is a component of CBT-i, but it's not all that it is. Sleep hygiene is actually not shown to be effective for insomnia. And what happens with sleep hygiene is patients get really focused on, okay, I can't have caffeine after 2 p.m., and I need to shut off all my screens, and I need to do this list of 20 things in order to be able to sleep. And it can actually create more anxiety for the patient, particularly for patients who have sleep-related anxiety. Sleep hygiene is kind of like dental hygiene. It's good practices to keep your sleep healthy, just like you brush your teeth and you floss your teeth. Dental hygiene keeps your teeth healthy. But when there's a problem with your teeth, you're not going to just practice dental hygiene, right? So sleep is like this. When there's a problem with sleep, sleep hygiene is not enough to actually support the patient with sleep issues. So this is where CBT-i comes in for insomnia. So there's a few components. I just mentioned sleep hygiene. So that is one component. It's essentially the lifestyle and environmental factors that affect sleep. But the other components are stimulus control, sleep restriction, relaxation, cognitive restructuring, and circadian rhythm entrainment. You might see that there's different ways that people talk about these, but these are some of the core components. So let's look at these one by one. The first one I mentioned is stimulus control. So what we're trying to do here is to strengthen the association of the bed with sleep. So this is where we want to recommend that people don't do things in their bed other than sleep. So they shouldn't be lying in their bed checking their emails or scrolling social media or doing their homework, or sitting there for hours watching TV or reading a book or things like this. Because what can happen is then the bed now becomes not just a place for sleep, but a place for all of these other kinds of activities. And so it reduces that stimulus, that almost that Pavlovian kind of response of feeling sleepy in the bed, right? Or associating the bed with sleep. So we want to strengthen that association by stimulus control by staying out of the bed when not sleeping, when they're not sleeping. The next component that I mentioned was sleep restriction. This is where we reduce the amount of time in bed in order to increase the sleep drive and the sleep efficiency. This is the one that people are often scared of trying. So you'll see all these horror stories. If you ever go into like an insomnia Facebook group, there's all these horror stories from people of like, oh my God, sleep restriction is horrible, so scary, it's so hard. But it is the most effective, one of the most effective components of CBT-i. And in fact, sleep restriction alone can be a standalone treatment for insomnia, independent of these other aspects of CBT-i. And it doesn't have to be this big, scary, very extreme thing where, okay, you can only spend time in bed from 1 a.m. to 6 a.m. and that's it. And that's what patients get scared of. So what you can actually do is a little bit of sleep compression. So rather than drastically reducing the amount of time they're in bed, you can start to compress that gradually, and then over time you're expanding it. Sleep restriction, that term is also a misnomer because we're not restricting the amount of time a patient is sleeping, we're just restricting how much time they're spending in bed. So they're still getting the same amount of sleep, but in fact now their sleep is more likely to be consolidated with fewer nighttime awakenings, with a shorter sleep latency, or the time it takes to fall asleep. Their sleep efficiency will increase, which is the percentage of time they're asleep compared to how much time they're in bed. We're aiming for a sleep efficiency of generally between 80 to 90%. So sleep restriction is actually time in bed restriction. And so that's what we're going for here. And so it's a very effective aspect. And when done well, it can really have a drastic positive impact on a patient's sleep quite quickly. And so this is one that I use a lot, but you need to gauge your patient's readiness to do it. And so if they're overwhelmed by it, you can start with a little bit of sleep compression. Relaxation is another component. And so this involves things like progressive muscle relaxation, guided imagery, breathing. And the idea here is to reduce the hyperarousal response that feeds into the vicious cycle of insomnia. So with relaxation, it's important to find a strategy that is going to work for your patient. Because if they're trying to do a relaxation technique that actually stresses them out more, it's not going to be very effective. So you need to collaborate with your patient to see, okay, well, what does help you relax? What works for you? Maybe it's an Epsom salt bath. Maybe it is doing some light stretching in the evening. Maybe it is doing deep breathing, or whatever it is. It's going to be different for each individual. I also emphasize to patients to practice these relaxation techniques throughout the day, because if the nervous system is in this hyper-aroused state all day, it's not just going to shut off at the end of the day like a switch when they do some deep breathing. They're already in this heightened state, so we want to regulate that nervous system and bring that down as the day goes on, so that it's not this like big ordeal to now try to calm their nervous system at the end of the night or at the end of the day before they go to bed. That's just not going to work very well. So this needs to be woven into their daily routines. The next one I mentioned was cognitive restructuring. So this is addressing unhelpful thoughts and beliefs that perpetuate insomnia. So the beliefs that, oh my gosh, like I'm never going to be able to sleep, or I cannot sleep without medications, or I only have like 5 hours till I have to wake up and I'm going to feel horrible tomorrow. Or they wake up first thing in the morning like, yesterday was a horrible night of sleep, like this is unbearable. You know, these kinds of catastrophic thoughts and unhelpful thoughts actually feed into the vicious cycle of insomnia. So starting to address those and unpacking those and challenging them is an important component. So for example, well, have you been able to function at work, or take care of your kids, or do those activities when you didn't get adequate sleep? Well, yeah, I was. Or, patients might have thoughts that, oh, I'm going to get into a horrible car accident or something. And well, has that ever happened to you? So kind of like examining the evidence and unpacking some of those things. So this is the kind of the CBT sort of component that we often think of. So that's cognitive restructuring. And then the other element that I mentioned is circadian rhythm entrainment. So this is where we want to strengthen the circadian rhythm and the sleep drive. So regularity of routines. In one of my other videos, I talked about consistency of the sleep schedule and how that's actually now being shown to be more important for health outcomes than duration of sleep. So maintaining a consistent sleep schedule, consistent daily routines. So light exposure is a big one that I talk to patients about. Getting bright light exposure around the same time every morning, and then bright light exposure throughout the day, keeping it dark and dim in the evening. Maintaining regularity with meal times is also very helpful for entraining the circadian rhythm. Regularity with activities, physical activities like exercise and movement is also very helpful. So a little bit of sleep restriction, a little bit of circadian rhythm regulation, some cognitive restructuring, some relaxation throughout the day. They're simple things, right? But all of these things add up, and they can have a really significant positive impact on your patient's sleep. So when you're thinking about referring somebody to CBT-i, I want you to remember that it's not just sleep hygiene. So talk to your patients about that, because they often think it's just the same old sleep hygiene stuff that everybody knows already, and it's not. It's not just therapy, so they're not talking about their, relationships and things like this. Yes, those things might be relevant and brought into the conversation, but this is a very structured approach. It's a skills-based approach that a patient can do. It's usually 8 to 12 sessions, and then they have the skills to carry on without the guidance of the therapist, or they can check back in whenever they need a tune-up. So with my patients where I've done CBT-i, they learn the skills and they feel empowered, and then they go off on their own and they're good. And whenever they have another bout of insomnia or sleep issues, they know what to do. And they know how to prepare for it, and they know not to catastrophize about it. So this is a really, really powerful approach that I recommend that you look into if you're not familiar with it. And then check out yesterday's video on where to find a CBT-i practitioner. There's different apps, there's different books. So I talk about those. In the video before that, I think it was the day before that, I did a talk on melatonin. So you can check out some of the previous lives if you want to learn more about sleep, and then join me again tomorrow for another really quick sleep tutorial. I'll see you then.